Hello everyone. Before we begin, here's a quickly review of our group work. Our topic is Case 1 Burn Injury. Each group member focus on a different sections, and you can see the name labeled in the top right corner of each slide. I'm Jinglin, and I prepared the case summary, anatomy focus, and test interpretation. Maron worked on the nursing application and 4 multiple choice questions, and she also helped us editing and PowerPoint design. Gertie did the AI reflection, and all three of us worked together on the APA reference. Now let's start with my part, the case summary. In our case, patient is Mr. T, 30 years old man who spilled boiling water on his right arm. He had blister, redness, and severe pain. Even though the burn looked serious, he could still feel his pulse, which means the blood flow in his arm is normal, and that is a good sign. His complete blood count, which is CBC, within the normal limit. So there is no sign of the infection right now. But his fluid balance was negative, which tells us he is losing fluid through the burn skin. And patient is in the negative fluid balance. For the anatomy focus, we are focused on the 3 layers of the skin. First one is epidermis. This is the outermost layer, like the shield that protects our body from bacteria, heat, and chemicals. Dermis is a layer lies beneath the epidermis and contains blood vessel, nerves, sweat gland, and hair follicles. It is what gives the skin the strength and flexibility. Hypodermis is fat layer. It keeps us warm and cushion the body against the impact. For this case, Mr. T has a second-degree burn, which means that both the epidermis and the part of the dermis are damaged. You can usually tell by blisters, redness, and pain. The wound is very sensitive to touch and even to air movement. Patients often describe it as a burn or stinging pain. It's important to protect the wound from infection and keep it clean and moisture so the new skin can grow back. If you look at the figure A in the slide, it shows the layer involved in the second-degree burn. Now let's look at the test result. The CBC is normal, which means there's no infection at this stage. The pulse are intact, shows there's no circulation problem. Blood is still reaching the tissue. However, the fluid balance is negative. That means Mr. T's body is losing more fluid than it taking in, mostly through the bone wood exudate. If it continues, it can lead to dehydration and hypovolemia. That means low blood volume. The skin has a really important job. It helps us to keep our body's fluid and electrolyte in balance. When the skin gets burned and damaged, those tiny capillarities start leaking fluid, kind of like the pipe that cracked. So we lose a lot of plasma, water, and electrolyte through the open burn area. Because of that, the patient's fluid level drops and can cause the dehydration and the electrolyte imbalance. If these conditions get worse, it can lead to something serious called hypovolemic shock. That means the body doesn't have enough fluid for the organ to work properly. That is why we give in the fluid early and carefully for the burn treatment. Now I pass to the next one to Maron.
To complete a nursing assessment, we're going to look for a few things. First, we're going to do a skin assessment. We're going to look for the presence of blistering and see how moist the wound is at the surface. We're going to assess the burn size, the depth, and the involvement of the dermis or the epidermis. And we're going to monitor the wound for any signs of infection, any pus, any discoloring. We're going to monitor the intake and output of the fluid balance closely. We're going to assess for signs of dehydration, monitor any vital signs for early signs of hypovolemia, and we're going to do a pain assessment. We ask the patient what their pain is on a scale of 1 to 10, expect severe pain due to the burn causing nerve endings, and lastly, we do a psychological assessment. We're going to see what type of emotional distress they're in and how they're coping with it. The nursing intervention for our wound care, we're going to cleanse the burn area with saline and I prescribe topical antiseptic. We avoid breaking blisters and opening them up, so we cover them with dressings. For fluid management, we're going to administer IVs, monitor our urine output, and encourage oral fluids if tolerated. For our pain management, we're going to administer medications to help with the pain and numbing before the dressing changes. And to educate the patient, we're going to make sure they know how to do wound care and look for any signs of infection. We're going to let them know the importance of hydration and what could happen if you aren't taking in enough fluids. And then we're going to teach them how to do sun protection and scar management after discharge so that we can minimize the look of the burn. We are also going to monitor for any complications. We're going to regularly assess for infections and monitor electrolyte imbalances. And potential complications that could come along with the burn include infection, dehydration, hypovolemic shock, scarring, and decreased mobility. Now we're going to do a little bit of a multiple choice. So which assessment finding indicates a complication developing from Mr. T's burn injury? A, moist wound with blister formation. B, intact peripheral pulses. C, decreased urine output and low blood pressure. And D, pain rated 8 out of 10. 2, which nursing intervention is most appropriate to prevent infection? A, apply ice packs to the burn area. B, leave the wound open to air. C, cleanse with sterile saline and apply prescribed topical antiseptic. Or D, break blisters to allow drainage. 3. Mr. T's fluid imbalance is negative. What is the nurse's priority action? A. Monitor vital signs and initiate IV fluid replacement. B. Administer diuretics as prescribed. C. Encourage increased oral intake only. Or D. Restrict fluids. Lastly, number 4. Which finding best indicates that Mr. T's burn is a second-degree burn? A. Presence of dry, leathery eschar. B. Full thickness tissue destruction with no pain. C. Mild redness only. Or D. Blisters, redness, and severe pain.
Hey, I'm Kirti. Now I'm gonna represent my parts that about reflection on generative AI use, saved AI prompt and response example along with the references. Now let's get started with my part. For the reflection on our use of generative artificial intelligence, we wanted to highlight how this specific tool supported our learning process throughout the case study. AI was particularly valuable in helping us integrate our knowledge of anatomy, physiology, and nursing care for the patient with a second degree burn. It guided us in understanding the connection between skin structures, especially the epidermis and the dermis, and how damage to these layers affect the body ability to maintain fluid and electrolyte balance. For example, we have learned that in partial thickness burn, the integrity of capillaries in the dermal layer is compromised. These increase capillary permeability, which allow plasma and electrolytes to escape into surrounding tissues. As a result, the patient experiences a negative fluid balance, which can lead to dehydration and hypovolemia if it is not managed properly. Using AI also help us organize our case in a logical flow, beginning from the anatomy of the skin to interpreting test results and finally applying appropriate nursing interventions. Another major benefit was how it improved our academic writing. AI provided structure, clarity, and correct use of terminology consistent with APA 7th edition format. And however, we made sure to cross-check all the AI generated content with trusted academic references such as Brunner and Sudar's textbook of medical surgical nursing and language of medical medicine to maintain accuracy and academic integrity. Overall, we found that generative AI acted as a supportive learning partner, not a replacement for critical thinking and clinical judgment. It encouraged us to deepen our understanding of the burn pathophysiology and the nursing responsibilities associated with fluid management and wound care. Yeah, now our next part is about saved AI prompt and response example. On the slide, we have included a specific example of how we use AI during the preparation of our project. The prompt was describe how understanding anatomy aids in interpreting negative fluid balance in the patient with second degree burns. The AI response explained that damage to the dermal layer from a second degree burn increases capillary permeability, which allows plasma and electrolytes to leak into surrounding tissues. The fluid loss results in a negative fluid balance. That means the showing that the patient is losing more fluid than they are receiving, a warning sign for dehydration and hypovolemia. The response also emphasized that the nurse understanding of skin anatomy and fluid regulation is essential in recognizing these changes early, ensuring adequate fluid restoration and preventing complications like shock. This example shows how AI can bridge scientific knowledge and clinical reasoning. It doesn't just provide information, it helps interpret the physiology behind critical findings, supporting evidence based nursing care. By paraphrasing, validating, and integrating this information, we were able to explain the relationship between the burn injury and the patient fluid imbalance in a more professional and accurate way. Yeah. Yeah, now the last part is about the references. Finally, for our references, we ensured all the information presented in our case study came from reliable and evidence based nursing and anatomy resources. For the references we use Chavner 2025, Guyton and Holt 2021, Forth and Matwing 2022, Potter and Perry 2023, Bruners and Sudash Textbook of Medical Surgical Nursing 2022, and many more. By combining AI assistance with these peer-reviewed sources, our presentation remains both academically credible and clinically relevant. In conclusion, using these references along with AI ability to help synthesize complex information and allowed us to build a clear and evidence-informed understanding of how anatomy directly influences nursing care in a burn management.